Welcome back to the Lymphoma and Related Diseases Registry. It is my pleasure to have Dr. Catriona Parker next to me. Hi, Kat.
Hi, nice to meet you, Eliza.
Yeah, me too. Can you tell us about yourself?
Sure, I'm a research fellow within the Transfusion Research Unit. I'm a mixed methods researcher. I haven't always been a mixed methods researcher. I originally started as a diagnostic laboratory scientist, and I worked predominantly in haematology and transfusion medicine. So I was the person that was really looking down the microscope and doing cross batches for transfusion. After that, I went into a not-for-profit sector and I predominantly worked in oncology clinical trials, and I also did a lot of policy and advocacy to try and improve the care and patient experience. After that, I went and did a PhD because I realised I was doing research, but I didn't actually have the underpinning knowledge and I wanted to be able to do research better.
Yeah.
And this is essentially where I found a love of mixed methods research.
Okay, so what is mixed method research?
Sure. Mixed methods research is essentially a mixture of two different types of research designs. Either quantitative research, which is where our outcomes are measures, so maybe taking things like blood pressure or survival outcomes, and the data that we collect are always numbers. Qualitative research is the other one, which is where we tend to collect things like people's experiences, perceptions, or opinions, and we often collect data through interviews or focus groups. So we use mixed methods research when quantitative or qualitative data alone is insufficient to answer the research question.
How can this research methodology be applied to the registries?
Yeah, that's a really great question, Eliza. With the advent of natural language processing and AI, that presents a lot of opportunities for the future about us being able to collect qualitative data and analyse large data sets. We understand more rich contextual data that's sitting behind why patients are answering the way that they are. If we were to do the same sort of thing in the LaRDR Registry, where we were asking patients surveys about their health and well-being, that we could also collect some qualitative data and understand more about the patient's lived experience so that we can optimise supportive care and design health services to benefit patients.
And have you got any plans for us to do it in the registry?
Yeah, I think there's a lot of opportunities. For example, it would be really great to work with LaRDR to understand how we could report information back to the community. What's the data actually telling us, and how would people like that data presented, and how often would they like to know those answers? The patient lived experience certainly matters, and there's an increasing appreciation of that. In terms of mixed methods research, LaRDR already does a fantastic job of collecting the quantitative side of mixed methods research so that we can really delve into patients' experiences of care and their experiences of different types of treatment and different types of lymphoma. I think that's where the opportunity really lies for LaRDR in the future.
Thank you for your time, Kat, today.
Thank you so much, Eliza.
Thank you. We'll see you next time. Bye-bye.
See you next time.